Well, Australia is on the verge of an AI boom in aged care. From robot companions to apps that track pains or falls, the devices are already being rolled out in homes right across the country.
Tech companies say they will improve lives of older Australians and even tackle loneliness, but not all experts are convinced.
Yes, tech companies say a lot of things, don't they? So let's break it down. We've got futurist Michael McQueen on the couch with us today. Hello to you, Michael.
Good morning.
OK, let's first start off. AI is already in the aged care sector.
Yeah.
What is it currently being used for?
So a whole range of things. So especially dealing with early onset dementia, so identifying that, even treating that to a degree, but also we're seeing things like smart carpets, smart flooring that can actually monitor changes in your walking pattern over time, which in aged care settings is great because it can be an early sign that you're at high risk of having a fall, for instance. Even, this is icky, smart toilets that can actually monitor in real time things like your bladder health, potential kidney disease, UTIs that could be undiagnosed before they become an issue. So we've got some of the preventative things like that. Then you've got robots as well, which sounds a little bit freaky, but confronting, this idea of a robot talking to you. But there's actually an Aussie company developed one called Abby. Abby is in 22 aged care facilities already, and the results are incredible. Like, we're seeing great for interaction and playing with residents.
So we're talking about things that can genuinely improve the quality of life for older Australians, aren't we?
Yeah, that's the idea. So we're seeing some great chatbots being rolled out as well. One that I saw recently that I really liked, this is actually in Toowoomba, an aged care facility out there, where they've got, essentially they've built a virtual dining carriage on a train. And so you can visit 10 different countries, and in the dining carriage you have cuisine that's linked to where you're visiting at the time.
On the show,
They were.
Isn't that a lovely idea? And so we know that novelty and variety is so important for brain health as you age. So what a lovely thing to be able to do with technology.
Yeah, I mean, it's really about sort of helping the human capacity rather than cost cutting and replacing those humans who work already in aged care.
Yeah.
There is a concern, though, that things will be outsourced, and we know statistically the outcome of this will be to the detriment of those in aged care.
Well, yeah, I mean, if you look at the numbers, we've got 1.35 million people already using aged care services in Australia. It is understaffed, it is underfunded, they are under massive pressure for the carer. So AI can help sort of shoulder some of the load, but there are risks around things like privacy. Also, I mean, you can automate caregiving, but you can't automate caring. AI doesn't care, hasn't got a soul, there's no empathy involved.
The rise of that robot nurse is one issue. I mean, there has been a really interesting study where they looked at the patient outcomes of a nurse actually doing it with just small things like touch, and the healing outcomes statistically were extraordinary compared to, say, zero touch and just having an iPad and little human contact.
No, it's a big difference, but I think in context, as Michael, I was just saying to you off camera, I've gone down a bit of an AI rabbit hole the last few weeks. This is happening and happening quickly. This is not space age stuff in the future. This is all within 5 years and probably less. Yeah,
that's right. So if you think about aged care especially, you've got to think of an integrated assessment tool rolled out by the federal government. It's an algorithm to determine how much support you should qualify for. There are already concerns it could be like Robodebt 2.0. So we've got to be very careful, keep humans in the loop. What humans can do can't be replaced by AI entirely.
Absolutely. All right, Michael, thank you very much for that.